Hi and welcome back to another video of Medic Notes. This video is on gynecomastia, which is abnormal enlargement of the breast in men. For introduction, it is a benign proliferation of glandular tissue in the male breast, clinically presenting as a firm disc of tissue underlying the nipple, which is at least 2 cm in diameter. Gynecomastia usually develops bilaterally, which means on both sides. It can be unilateral during the initial stages, becoming bilateral after some months. Only around 10% of cases are unilateral. Gynecomastia must be differentiated from adipomastia or lipomastia, which refers to fat deposition without glandular proliferation, where it is actually adipose tissue, instead of true breast tissue. Gynecomastia is more commonly associated with physiological cause. Drugs, like cimetidine, digitalis, spironolactone, methyldopa, captopril, calcium channel blockers, and chemotherapeutic agents. Radiotherapy. Hepatic cirrhosis, or hypogonadism of any cause can also cause gynecomastia. Other less common conditions are hyperthyroidism, refeeding syndrome, renal failure and dialysis, testicular tumors, and congenital abnormalities like Kallmann syndrome and Klinefelter's syndrome. For its general mechanism, it is mainly due to high levels of circulating estrogen, increase in the estrogen-testosterone ratio, and due to androgen insensitivity. Let's look at the mechanism of different causes. For physiological gynecomastia, it most often occurs at puberty and middle age. In males, important sources of estrogen production are the testes, via luteinizing hormone and human chorionic gonadotropin secretion, and peripheral tissue and fat, where aromatization of androgens to estrogens takes place. When present at puberty, gynecomastia is believed to be caused by a faster than normal initial rise in estrogen production. Whereas for older males, they have decreased testicular function, increased weight, and more fat storage. This leads to decreased testosterone production from the testes and increased androgen to estrogen aromatization peripherally. Hence a higher estrogen level will then cause gynecomastia. Next we look at the drug causes. Each drug have their different mechanism of action. Spironolactone can cause gynecomastia due to multiple mechanisms, such as increased aromatization of testosterone to estradiol, decreased testosterone production from testes, displacement of testosterone from steroid-binding globulin, causing increased clearance, and it also binds to androgen receptors and prevents testosterone binding. For digoxin, it is structurally similar to plant-derived estrogens, where it can stimulate estrogen receptor directly. For histamine 2 receptor blocker like cimetidine, there are 2 mechanisms proposed. It blocks androgen receptors, causing increased estrogen to androgen ratio. And it also alters prolactin level, causing a negative feedback on gonadotropin hormone, hence less LH produced. For proton pump inhibitors, there is inhibition of estradiol metabolism, and this increases the estrogen to androgen ratio. Most of the mechanism in the end leads to a high estrogen level. Next we look at hepatic cirrhosis, which is commonly associated with gynecomastia. In liver cirrhosis, the liver's normal metabolic functions are impaired, leading to a reduced breakdown of androgens. The increase in circulating androgens results in increased aromatization in the periphery to estrogens. Another cause is hyperthyroidism. Few theories have been suggested for the relationship between gynecomastia and hyperthyroidism. There may be increased adrenal androgen production, and an increase in the rate of peripheral androgen aromatization. For cases of hypogonadism, as with aging testes, primary failure of the testes leads to greater deficits in testosterone production compared to estrogen. This imbalance may lead to gynecomastia. In refeeding syndrome, it is believed that gonadal function is suppressed during starvation. When refeeding occurs, the pituitary adrenal axis is reactivated and increases testicular function. Gynecomastia occurs as a result, via the same mechanism as in puberty. In renal failure and dialysis, it is similar to refeeding after starvation. Testicular function is suppressed during renal failure, and then reactivated when the patient commences dialysis. Gynecomastia is seen 1 to 7 months after dialysis initiation and usually resolves within a year. For testicular tumors, the Leydig cells of the testes produce both testosterone and estrogen. Benign Leydig tumors produce an abnormally high amount of estrogen compared to testosterone, and thus may give rise to gynecomastia. Tumors that produce HCG also cause gynecomastia. The increased levels of HCG stimulate Leydig cells to produce more testosterone and estrogen. The testosterone is converted to estrogen both physiologically in the periphery and pathologically by the tumor itself. Hence there will also be high estrogen level, thus causing gynecomastia. That's all for this video. Thank you.